in the 1980s and 1990s, when people were utilizing epidurals for the first time as pain management in labor, they weren't allowed to get epidurals until they were like 5 to 6 centimeters or in active labor. And then if they were complete or they were too far into their labor process, they didn't do it. And then a bunch of studies were done. Yeah, that said basically, oh, there's no difference. There's no difference in C-section rates in women if you get your epidural when you're 1 centimeter or you get your epidural when you're complete. And just as you know, as a professional, as someone with a master's degree who understands science and literature, I highly disagree with these studies because, as a clinician, as someone who has watched this and practiced it multiple different ways, women who come into labor and get their epidurals early have higher rates of C-section. And there's a couple different reasons why that is, in my opinion. Number one, you slow movement down. And if you don't have a nurse who's highly committed to moving your body every 30 minutes, your baby's going to get stuck in rotation somewhere. Number two, think about how lax your legs are. You can't walk, you can't move around. Your uterus also responds to the epidural, and those contractions aren't as strong when we add an epidural, especially for women who weren't active to begin with. Like if you're 2 to 3 centimeters and you get an epidural, it's going to shut down your labor. Now we have to augment. We have to augment with Pitocin. We have to do all of these things. And the third and biggest reason that I think is very important for people to understand this is epidural. This is science, and the studies do show this. Epidurals have a twofold increase in instrumented birth. And what that means for you is if your doctor doesn't do vacuum or forceps, it's a twofold increase in C-section. Because if you can't push your baby out, they're not going to help you. And I really hate to say that, because I am so blessed to work with a doctor who offers every one of my patients instrumented delivery if they need it. I mean, I would be doing double, if not triple the amount of C-sections if I didn't have someone like Dr. Herbie on my side. In my previous practice, not all of my doctors even offered vacuum. And for me, that is wild that you would tell a woman to get an epidural without any informed consent around it and not tell her, but by the way, if you can't push your baby out, I can't help you, because I don't offer those services.